and I am the Associate Dean for Community Engagement and Diversity Inclusion for the School of Nursing. And it is my absolute pleasure to introduce Miss Cierra Battle. She's RN, BSN. Yeah. And she is currently graduated from our program. She graduated in December of 22, and she is her role currently is labor and delivery at the University of Louisville Hospital. She had a fantastic experience last year that I wanted her to share and to talk about how that increases cultural competence among nurses. Ms. Battle, you can go ahead and start.
Thank you so much. Hi, guys. Hi, everyone. As she said, my name is Cierra, and I'm a labor and delivery nurse currently working at U of L. Last year, I graduated in 2020, December. And last year, after graduating and after passing NCLEX, I decided to go to Tanzania for 7 months to work in labor and delivery there. So today I'm just going to be sharing a little bit about my experience and how that has impacted my nursing care personally, and the way I go about providing care to different patients of different populations and different backgrounds, which is really important as a nurse or any healthcare provider. So I'll be sharing with that. If you guys have any questions, we'll be having a short Q&A at the end, so feel free to just write them down, and I can answer them at the end of the presentation. Right. So today I'm going to be talking about healthcare in general in Tanzania related to maternal health. While I was overseas, I was in labor and delivery the whole time. So most of this will be about maternal health, specifically pregnancy and child health. And the biggest thing that I want to talk about is the importance of patient populations of different backgrounds, cultural backgrounds, religious backgrounds, all those type of things, how important it is for us to have experience and exposure to these populations. And then at the end, I have a few ways that you guys can get involved or opportunities available if you guys are interested in increasing your experience and interaction with these students or with these patient populations. All right, so I was in Tanzania. If you all are unfamiliar, Tanzania is in East Africa. Most people, they know about Kenya. They've heard of Kenya before. Kenya is right above Tanzania. So Tanzania is an East African country, also surrounded by like Mozambique, the Democratic Republic of Congo, that area, that's where Tanzania is. The other map on your right, I think it'll be your right, is a map of Tanzania itself, and just showing some of the regions. In the middle of the map, you can see Dodoma. Dodoma is the capital of Tanzania. Where I was staying was Dar es Salaam, off to the coast. There you can see by Zanzibar. That's where I was staying. It's a coastal city, big city, upcoming. I was there in 2018, and when I came back in 2020, it was so different. They've improved so much in infrastructure and everything, but it's a beautiful city, very tropical. People are friendly. The food is amazing. Everything's great. I'm very biased on Tanzania because I love it, but it's a great country to visit. The language that they speak in Tanzania is Kiswahili or Swahili. So that's their national language. Some of the things that Tanzania is known for, if you guys have heard of Serengeti National Park or those big safari parks, a lot of them are found in Tanzania. Mount Kilimanjaro is found in Tanzania, which is the largest freestanding mountain in Africa. Zanzibar is the island off of the coast there you can see on the map. And that's a big tourist spot. Beautiful beaches, beautiful water, beautiful coastal culture there as well. So plenty of things going on in Tanzania. The current president is actually the first woman president. Her name is Mama Samia Hassan, and she's the first woman president. She assumed the role while I was there, so there was a lot going on in the city and in the country. It was a big time for them. But this is Tanzania. These next few slides are some of the pictures of the hospital I was at and kind of the grounds and the campus of the area. I was at Muhimbili National Hospital, the Mloganzila campus. You can kind of compare it to U of L, how U of L Hospital has different campuses, like they have Jewish Hospital, U of L, downtown, all of that. You can kind of compare it to that. Muhimbili is, their main campus is in the city center, so like downtown. This hospital that I was at was more farther out, probably like 30, 45 minutes from that main hospital. But this is just a picture. It's fairly new, a fairly new hospital. I believe it was built in 2017. It's very big, very spacious, and the grounds are also beautiful. Here is a picture of the outside and my work, Sophie. This hospital provides all services that you can think of. They have outpatient services, inpatient services, everything from emergency department, labor ward, psych unit, everything, internal medicine, everything they have here. This is a national referral hospital, which means that all the smaller peripheral hospitals or health centers or clinics, they send their patients from there to this hospital. Most of the time that can be from overcrowding. It can be from maybe just a complicated case that can't be treated or managed well at that smaller facility. So they'll send those people here to this facility, this hospital. This hospital is also a research center, and it's also a university teaching hospital. So also similar to U of L. So while I was there, I met with a lot of nursing students, medical students, doing their internships, their clinicals. There is a university closer to the main campus or the main hospital that is associated with this hospital, kind of like U of L again, how our students go U of L to U of L hospital for clinical. It's kind of like that. Those students, they're kind of filtered through this hospital and the main one downtown. But this is the outside. The next few pictures will be of the actual labor ward that I was in. I was in labor ward for six and a half months, and I spent all of my time there, so I got to know this place very well. Labor ward consists of 2 delivery rooms. These pictures, they're the same room, just kind of 2 different angles, but this is one of our delivery rooms. The other delivery room was right next door, but it was reserved for COVID patients, COVID positive patients. So we didn't really use that room as much. But inside the delivery rooms, we have the delivery table, we have 2 warmers for the babies, we have 2 scales on the other side of the room, and then kind of in the back corner, there were some cleaning, decontamination equipment there as well in this room. Aside from 2 delivery rooms, we had a recovery room where our moms would go after their vaginal delivery or after their cesarean section. They would be in recovery room for 2 hours during their recovery period, and sometimes longer, especially our cesarean patients. They would be there a little bit longer. We had a waiting room towards the entrance of the labor ward, and I don't have a picture of the waiting room. I wish I did, but there were always moms in there. So the waiting room is just a huge room, if you can imagine, and there's dividers on each side, like little curtain dividers for each little spot that the mom can go in. Kind of like an emergency department triage, maybe, if you could imagine. And so this room is where the moms would come in for their initial assessment. They would be monitored there if they needed monitoring. And ideally, they would stay there until they reached 8 centimeters dilated. When a woman reaches 10 centimeters, that's when she can push and have her baby. So she would wait there until 8 centimeters, ideally, and then they would take her back to the delivery room. Most of the time that did not happen. So the waiting room was also kind of a delivery room. But it was a pretty spacious room. And what we would try to do is keep our moms that were expecting vaginal delivery on one side, and then our moms that were being prepared for cesarean sections on the other side, just to kind of keep things a bit more organized. We had like a little nursing table there with all of our documentation, all of our charting. So like any of our documenting on patient care, whatever was all paper, was all handwritten. So all of our charting and everything was on that table. We had a big cabinet with all our supplies in it for starting IVs. Some of our medication was found in there, catheters, all of that kind of stuff was readily available. And then there was a bathroom available for the moms as well in that room. We also had 2 operating theaters or operating rooms where our cesarean sections took place or any other procedure that needed to be taken place. We had 2 of those. I have a picture for you all. This picture here is a picture of our operating room. So inside we have our table for our moms to be laying, all of our anesthesia equipment there in the back. We have our suction equipment. We have a cabinet here kind of off in the front of the picture where all of our equipment was, like our sutures, any of our cleaning supplies, extra blades, anything like that, extra dressings was in that cabinet. And then towards the back of the photo where that door is, that's where we would scrub in. And then on the other side was the other operating theater. So it was both of them, and then the scrubbing room was in the middle. This is a picture of me and one of the midwife students that was there scrubbing in for his first cesarean section. I was able to do a lot of things over in Tanzania, and one of my favorite was scrubbing in cesarean sections. Something I'll talk about a little bit later is just the roles of the professionals there and kind of the difference between the nurses, the midwives, and everything like that. But as for me, I was able to do almost everything, everything and anything they wanted me to do. So I did scrub. I was able to assist the surgeons in cesarean sections and also just act as a scrub tech, like passing them supplies or passing them the tools that they need to do the procedure. As I said, this was a national referral hospital, so we were receiving complicated cases from those smaller hospitals around the city. A lot of the moms that came in, they were not having normal labor or uncomplicated pregnancies or labors. So the most common thing that we would see is preeclampsia in our moms or eclampsia. Preeclampsia is a complication in pregnancy that women can get if they have high blood pressures, they have protein in their urine, and a few other things to make up preeclampsia. But that was the most common thing that we saw moms coming in for, as well as eclampsia, which is when a mom who has preeclampsia has a seizure, then she's considered eclamptic. So those moms were coming in most frequently. And most of the time it was due to not being able to be treated at the peripheral facilities, probably most of the time due to medication being readily available, or also just the acuity of the mom's condition. The second most common thing or diagnoses that we would see is non-reassuring fetal status. This one was kind of difficult to grasp because non-reassuring fetal status could mean a lot of things. Most of the time they would come in and when they said non-reassuring fetal status, it would mean that just something changed in the baby's condition, whether the baby's heart rate was decreased or was low, or maybe baby hasn't been moving as much as normal, or anything around the fetus, they would come in with that diagnosis. Diagnoses was kind of difficult as well, being able to understand what was necessary to take action or to intervene in these moms, because sometimes they would come, they would give us a report and they didn't really have information or enough information for us to make those decisions. And me, when I hear non-reassuring fetal status or something's going on with the baby, you want to make those decisions quickly. And it was difficult when that information wasn't available to be able to intervene in a timely manner, which kind of leads to some of the things that I'll talk about in a few seconds. But these were the 2 most common things that I've seen. Something that I kind of want to share is I came to Tanzania right after graduating nursing school. So this was kind of my first time actually being fully immersed in working in a labor ward. I say labor ward, but labor and delivery unit. And so a lot of things were new. It was very overwhelming at first because the only experience that I had prior was from like simulation during nursing school, lecture material, or like anything that I had witnessed in like shadow opportunities or things like that. But this was my first time actually working, you could say, in a labor and delivery unit, and the environment was different. Things were new. I was seeing things for the first time, you know, that I've heard in class, but never really saw. Things that I knew like textbook what to do, but in real life, it's not that way. So it's very interesting. It was kind of hard at first. I kind of was telling them like, hey, I want to take my first month just to observe and just to watch. But they did not. They were not having that. They wanted me to be like hands-on my first day. So that's, by the time I finished, I was doing everything. Like I was very comfortable in my skills and the knowledge that I gained. And I think coming back here and working in labor and delivery now, it's definitely changed my perspective as far as my personal sense of confidence in my work as a nurse and what I do. I don't think if I chose to stay in the US and, you know, go straight into labor and delivery, if I was able to, that I would be in the same place, like mentally, or just in my confidence in my skills, and like what I do and what I know as compared to how I am now with this experience. So it was a great experience, and I learned so much, and I'm so thankful to all the people there that were helping me and pushing me to do these things. One of the things that I came across during my time there was I had two moms who ended up passing away, two maternal deaths I witnessed during my time there. And I have a little bit of information. This is from UNICEF. Tanzania is categorized as being or having a very high maternal mortality rate. And though they've made some improvements, because I've had conversations with some of the people who work there, you know, they know their country, they know how things are. And they kind of tell you how things are trying to be improved, but kind of how things get in the way as far as like legal issues, government issues, access to things like money and things like that. So Tanzania is categorized as a very high maternal mortality rate. And like I said, during my time there, I saw two maternal deaths. And I put this little snippet in this slide because I agree with what it says. It says most maternal deaths can be prevented if they have birth attendants or people attending the birth that are skilled health personnel, whether they be doctors, nurses, or midwives, if they have proper equipment and supplies, and if they can refer women in a timely manner. I can say that those two maternal deaths could definitely have been prevented because of these things listed in this little snippet that I got from UNICEF. Because this is a referral hospital, the time it takes to get a mom from one hospital to another is a very long time. Where Loganzila is, like I told you, it's kind of like 30, 45 minutes away from the main campus downtown, or what we would call downtown. And so it takes a long time to get one patient from one hospital to another. The infrastructure as far as roads, traffic in Dar es Salaam, the city that I was in, is not fully developed. If a mom is coming from a hospital or a health center that is in an area that's not, not close to downtown or not close to the city, it's going to take her a while because those roads are not paved. If there's roads, you know, it'll take more time for them to be reached by an ambulance, if an ambulance is available, to get them to where they need to be. So I think the time in which a mom gets from one place to another is the biggest, because both of those moms, they were hemorrhaging, which means they were bleeding out. And so by the time they arrived, for one of them, it was kind of like almost too late. But also just being late, you know, there's only so much you can do. And so these things are some of the things that when you're in a different country or in a different environment, you have to think about how those things influence or impact the care that they give, and really how much they can do for those patients that are coming in to see them. I also have a little bit, this chart is on women in the US, and this is from 2018 and 2019. The 2019 is the green, and it was an increase from 2018 to 2019 in maternal mortality rate for non-Hispanic white women. That's what this chart is showing. And so for here, it's 44 deaths per every 100,000 live births, which is 2.5 times more than for those non-Hispanic white women. So it's a very high mortality rate. You could kind of compare it to the disparities that we have here for Black women when it comes to maternal health, and also there in Tanzania, how they're struggling with their maternal mortality rate as well. These pictures, this one with me and the baby doll and Hashim, he's one of the midwives. We were doing a workshop on helping baby breathe, also known as neonatal resuscitation. So this is what we would do if baby comes out of mom and isn't breathing. And so we were doing a workshop, a little class, teaching the nurses and the midwives and some of the students that were there during this time what to do. I think one of the similarities between working there in Tanzania or at this hospital and working here is the emphasis on education. These people, I've never met people who love to learn or love to keep up their knowledge as much as these midwives that I was working with. They are always doing research. They're always trying to make sure that the care that they're providing is the most relevant, the most up to date as far as what evidence says. And that has taught me a lot as being a nurse and wanting to eventually become a midwife, just the importance of, knowing your stuff, making sure that what you're doing is the best for your patients and for the moms that are coming in. So that's one of the similarities, because I think even here, like when you work or even when you're in class, you have things that are always given to you just to increase your knowledge, kind of to be up to date in what you know, which is important going forward in your career. The other smaller picture is another workshop that we were attending in the NICU, and I don't remember what the presentation was about, but we had a couple of these like every month that we would go to. Someone would present on a topic, and then we would kind of have like a post presentation quiz and discussion and questions, and how we can go about implementing things better based on whatever it was that we were talking about that day. These are some pictures of the people I worked with in labor ward. Something that was different is the roles and responsibilities of the people working there. Most of labor ward were midwives. There were a couple nurses, like maybe 2 nurses. But most of them were midwives, which means that the way that care was given was more midwifery-led. As compared to here, we're used to everything being led by providers, doctors, OBGYNs. There, everything was midwifery-led model of care. And so that was very different, because you don't necessarily have, I guess, like how you would say, like a chain of people that you would go through to do things, I guess. Here, these midwives, the mom would come in, they would assess the mom, and they are the ones who are providing or giving that mom care from the time she arrives until the time she leaves. And so it was very different, because these midwives and then the nurses that were there, I couldn't really tell the difference as to who was who in the beginning, because even though they have different roles, essentially everyone is doing the same thing. For example, if you go to the hospital, if you go to Louisville labor and delivery, if you guys come to visit me, you would be able to tell who's a nurse, who's a doctor, or whatever, who's a midwife, probably by the moment you walk in and once you see people moving around, interacting, you could tell the difference. If you come here, if you go to Mloganzila, or really, I think any hospital, really in Tanzania, you can't necessarily tell who is who because everyone's kind of doing everything and everyone is able to do everything, which is both good and bad. But we also had interns there on the floor. So we had nursing interns, medical student interns, people who were doing their internships. And the doctor, the provider, he or she, you wouldn't really see them unless the mom went for a C-section, or unless there was like a really big emergency, they would call them in. So most things are handled by these people, by these midwives. And so I was kind of telling Dr. Hines Martin earlier that I kind of adapted to that because when I was there, I was doing any and everything. You know, a mom would come in and I would take her, I would be with her from the time she comes in until the time she delivers or until the time she leaves. And so coming back here and going to labor and delivery, I was very, I had to ask like, okay, what is the role as a nurse here? Like, what do you all do? Like, what is everything that you all are used to doing? You know, like who deals with baby? You know, if baby comes out and it's not breathing, like who does that? Like, what's the doctor doing? Like, how far do you take your mom without calling the doctor in? Can you deliver a baby? Have you delivered a baby? Those are the questions I was asking because now naturally I just want to do all those things myself. And those are the things that I kind of learned to do, which kind of plays into what I was saying earlier about how having this experience in this country, both for like clinical skills and knowledge, but also just working with different patient populations, how it has allowed me to kind of, you know, be comfortable in my skills and in my role as a nurse and what I can do. And it has helped a lot. And so as far as working now in labor and delivery and how it has impacted me, something I love about Louisville Hospital is their patient population. They have patients from all over, different cultures, different religious backgrounds. They speak different languages. And that's what I like about Louisville. That's why I wanted to work there, because I wanted that exposure to these patients. You know, these living in Louisville, where the Louisville Hospital is, those are the patients that really represent that area that we're living in. So those are the patients that I want to take care of, that I want to help. And so being at Louisville, it's a good opportunity to interact with these patients, interact with these people who come from different cultural backgrounds. And I think the most important thing that having that experience with other cultures and other patients from different cultures is being an advocate for your patient. When you meet someone and you learn about their culture and you learn about their background, you know, how they do things, what's important to them, kind of their way of thinking and how they go about doing things, it makes sense. You know, it makes sense for you to meet someone, and when you know how they're thinking, why they make the decisions they make, you know, or why it may be difficult for them to understand one thing or not want to do another thing. And so for me, I think the biggest thing is it has allowed me to be an advocate for my moms that come in who are of different cultural backgrounds. You know, an example is getting any type of pain medication or like epidurals during labor. A lot of my moms from African backgrounds that come in, they don't want epidurals, you know, they don't want pain medication during labor, during delivery. And it's easy for a lot of nurses and doctors to kind of look at them like, well, you're crazy. Like, why don't you want help? Like, obviously you're in pain, you're doing this, you know, like you're having a hard time handling it. But me, here in Tanzania, there was no epidurals, there were no pain medications for these moms. And so coming here, and I hear these moms don't want it, it makes sense, because where they're from, that's not something that's readily available. That's not something that they're used to. And so me, I can advocate for my patient and saying them, well, this is this patient's background. This is probably the reason why she doesn't want 1, 2, and 3 interventions done. Proper communication with your patient is very important, especially when your patient doesn't speak English. You need proper interpretation, proper translators there, because a lot is lost. I've seen when working with patients who are non-English speaking or have different cultural backgrounds between what is said by the patient and what the provider or whoever thinks that patient wants. So having these experiences and interacting with these people from different cultures allows you to have more knowledge for yourself as far as advocating, and kind of as far as what to expect. Just because this mom comes from Tanzania and she's here and she doesn't want an epidural, doesn't mean you can't properly educate her on the other options that she has available for pain management. And so those are kind of some of the things that I've seen or that helped me kind of transitioning back. Because even for me, it's been a transition, coming from working in Tanzania to working here. Again, even I've had to readapt back to how things are, or how we interact with things. So I think that would be one of the biggest things that I've got from working with this culture, or this culture's people, people from Tanzania or African culture. And the same applies to any culture or any group of people that you work with. It's important that you take the time, whether that be in school, whether that be on your own, preferably on your own, to get to know these things and you don't have to know everything about a culture, everything about a group, but just knowing a little bit from each group makes a big difference in the care that you give your patient. And I know a lot of my moms that come in and they speak Swahili, and me, I'm not fluent in Swahili, but I know, and I'll come in and I'll greet them in Swahili, I'll talk to them as much as I can in their language. And they're so happy, they know, me being here and them being in a place that's different or new to them, being able to see someone who acknowledges their culture, acknowledges their background, it makes them happy. And, it makes them have a better patient nurse, patient doctor, patient midwife, whoever relationship in that time that you're providing care for that person. So that's why it's important to have these experiences and these interactions with people from different cultural backgrounds. Lastly, here are some things that you all can do just to increase the interactions that you have with people from different backgrounds. To be honest, we live in a city that's very diverse. We have a lot of people from a lot of different places. So it's not that hard, to mix and mingle with people from different places. But for my students, you can volunteer. For example, I volunteered with KRM, Kentucky Refugee Ministries, while I was in school. And they have people who come from many different places, from Cuba, from various African countries, from the Middle East. And there is different opportunities to do things depending on what you like. I was working in the medical office, so I was able to interact with those people in that way. There's also plenty of student organizations that you all can get involved in. Even during high school, there's different organizations that you all can be involved in to meet new people or to learn about different cultures and different backgrounds. When you all get to college, or all my students that are currently in college, I would definitely encourage you all to study abroad. I actually studied abroad in 2018 to Tanzania, and that was kind of the groundwork for me wanting to go back. So there are numerous of study abroad opportunities available for you all out there, even after graduating, even for professionals, you all can still go abroad. And these are just some examples of programs. I went with KEYS, this top program, to Tanzania, and they have places going everywhere. ISLP, I'm sure my nursing students have heard of ISLP. I've also been on a trip with them. It's a great opportunity as well, kind of for a short-term study abroad trip. That's something that is available. For professionals, for nurses, doctors, or for when you all graduate and become nurses, volunteering is always an option as well. Mission trips or / travel nursing is also a good thing to get into. I am part of an organization, a nonprofit organization called Care US TZ, which is listed here. And it's actually founded and ran by my professor who took me to Tanzania in 2018. He's the president of the organization, and they take professionals, nurses, doctors to Tanzania a couple of times a year. working in different environments, working in hospitals, working in health centers. And each time they go, they have a different focus or topic that they go on. So that's another opportunity. And then also just education, educating yourself, anything that you all do outside of school or outside of work that's going towards you increasing your cultural competence and understanding the cultures or backgrounds of other people and how that plays into your role as a nurse or a professional or even just a person, a human being, because, we live in a world where people are different and people are coming from a lot of different places. So it's important to be able to understand where people are coming from. Even that is a great thing to do. And that is all I have for you all. Thank you guys so much. Asante sana. Asante sana is thank you very much in Swahili. If you guys have any questions, we can go to the questions, Q&A. Should I unshare my screen?
You can unshare if you would like. Looks like you've got a lot of applause for your presentation. You have the option for everybody that's in attendance. You can either turn on your screen and ask the question, or you can put it in the chat, and I'm more than happy to read it and have Cierra respond. Are there any questions? Okay, I've got Deborah Anderson has her hand up.
Yes. Hey, Cierra. That presentation was absolutely excellent. I just want to thank you so much for sharing it with us. I had a daughter who was in the Peace Corps in Tanzania a couple of years ago, and I had the opportunity to go there twice. So I saw the Moragora region. Did you see on your map? That's where she was, a little village outside of Moragora. So all of what you said just resonated so much with me. Mm-hmm. And my question for you after those comments, my question for you is, when are you going back? Because I know you are.
I am going back. I made a very impulsive decision. I actually went back in December for New Year's, but it was for a very short time. I plan on going back in June, hopefully, with the CARE USTZ group that'll be going. So hopefully in June, I'll be there for a little bit. Yeah.
That's great. Thank you so much.
Thank you.
I have a hand from Paul Clark. Paul?
Oh, Dr. Clark.
Hey, Cierra, how are you?
Hi.
I love this presentation. It took me back to the time when we were there in 2018. So it was really awesome to listen to your perspective on it. I have a question about eclampsia, because as an emergency nurse, we are actually currently doing a national study to figure out how to prevent eclampsia in women, especially postpartum. They come into the emergency department with high blood pressure, and we're not asking them the question, when did you deliver, or have you been involved in a recent delivery? We just kind of assume, oh, they've got high blood pressure because they're in the ER for whatever reason they're there. Mm-hmm. And the death rate, the maternal death rate in the United States is horrible, and a lot of it is related to eclampsia. So what I'm wondering is anything going on in Tanzania? Because I noted the chart you had, I think it was from statistics from Tanzania. Is there any kind of education that you guys are giving moms to help them, understand the problem of being eclamptic or having high blood pressure after delivery, and, to help them, come back in to be seen if they do have any of those symptoms? Is there any education going on to try to prevent that?
Well, actually, I think that's an area that needs a lot of improvement. Because while I was there, that was something that I ended up asking a lot of questions about, as far as moms coming in with preeclampsia, or they're already eclamptic, just was education around preeclampsia or their condition during pregnancy. And it seems that the education that they get, or they're supposed to get during their prenatal visits, is not necessarily adequate. Or if they're even mentioning preeclampsia or things like that, I'm not sure if that's being done, or if it is, to what extent it's being done. And I think even just education on pregnancy in general probably needs a lot more improvement as far as what they're getting in their prenatal visits. Because there are a lot of things, even about what to just expect during delivery. The moms, they came in and a lot of them didn't know what to expect. And it led to sometimes a difficult labor and delivery. So I think that's something that probably needs more education or needs, something done there to improve that or just to increase education around it. Because even postpartum, I did have a couple of patients who still had, postpartum preeclampsia, and it wasn't necessarily managed well. And so I think education across the board on that subject is probably needed.
Mm-hmm. Sounds like this is an international problem, but I really appreciate your perspective. So, Asante Sana.
Yes, good to see you.
Nice to see you too. Thank you.
We have a question from Dr. Higdon.
Hi, this is Angie Maringer from Owensboro. I just want to commend you, and what an excellent presentation. I'm a labor and delivery nurse, and you've reignited some flames. I've not been in at the bedside for a while, but when you were in Tanzania and you said that you have a limited language, how did you accommodate for that?
Yes, so when I went to Tanzania, I had previous experience there in 2018. My Swahili wasn't great, but I knew enough to get around. And so this time going, I've always been learning by myself, Swahili, teaching myself. But being there, majority of people speak Swahili. So it was kind of like I don't have a choice but to learn and to try and speak. So the little that I knew, by like my second, third month, I was only speaking Swahili with most people. Like I would only speak English, sometimes at the hospital because the employees, they know English, or like at home, I would speak English. But most of the time I was speaking Swahili, and it just came from hearing it all day, every day, talking to people. Like I would talk to anyone and everyone on the street, which, probably could have been toned down a little bit, but I was talking to everyone, and that's how I learned, just talking. I was surrounded by it, so you catch on pretty quick, and Swahili is a pretty easy language to learn.
Are there other questions?
Can I ask another question?
Sure.
Did you go on your own? You just decided to go to Tanzania, or did you go with a company? And where did you live?
I went completely by myself. It was something I wanted to do. I just didn't know how I was going to do it, but I went by myself. Luckily, I had Dr. Mkanta, who is the director of the Keys Tanzania Study Abroad program, to help me kind of get things formalized and organized. But I went completely by myself. I stayed with the host family for about 2 to 3 months. And then after that, I just went off on my own.
I have one question.
Mm-hmm.
We have students who are in high school currently. They're pre-nursing.
Yeah.
And sometimes they wonder, is this all there is about nursing, or is this for me? Can you give them some words of wisdom that illustrate why nursing is a good place to be?
Yes. So nursing, I don't know if you've heard, you probably have, but you can do anything with nursing. I just saw Kayla's comment. Hi, Kayla. You can do anything with nursing. You do not have to be at bedside if you choose to be a labor and delivery nurse. You don't have to stay in labor and delivery. You can teach. You can do whatever. You can be a travel nurse, which is the big thing now. There's so much you can do. Me personally, why I love nursing is I like interacting with my patients, especially as a labor and delivery nurse, because I've always wanted to do labor and delivery. I love interacting with these moms, interacting with these women. I love learning about pregnancy, about what's going on in the body, about baby, how everything works during the delivery process. And so I think if you, as a high school student, if you are interested in nursing or think, nursing is what I want to do, but I'm not sure, I would say to talk to a lot of people who are nurses, but also try to get as much experience, whether that's shadow, like right now it probably would have to be shadowing, or even when you get to college, if you choose nursing, you can always change your major. But give it a chance. I think once you find what it is that you want and you find that it works for you, you find that you love it, you were like, this is all I want to do, you will know. And I think for nursing, that's something that you find out pretty early if it's for you or not. But you will know. So you don't have to, decide everything now or figure everything out now. But nursing is great. It's amazing. It's very rewarding. Like I said, when you find your place in nursing, because there's so many places you can be, once you find your place, you'll know, and you'll know what you want to do with it. You'll know where you want to take it, where it can take you. And so just talk to a lot of people, get a lot of experience doing, whatever it is, volunteer, shadow, get involved in organizations around nursing, around health professionals. And if you have any questions, you can always talk to me, email me, text me, whatever you want. I'm available because nursing is great. I love nursing.
Okay, are there any other comments or questions? We have about 3-4 minutes.
I think there was one more question. Someone, I don't know where it is, in the chat. I saw it pop up, but I didn't see it.
Here, let me see.
From Pat Davis.
Thank you.
Thank you.
Thank you, guys. I wish I could see your faces to see if I remember any of you all, but I can't.
Well, I would like to thank everybody who participated and took the time to listen to Cierra. I think what she had to say was very valuable, regardless of where you are in your career in nursing or pre-nursing. You've gotten a lot of comments to say they enjoyed this. Great job. Thank you so much. And that shows how much they appreciate what you had to say. So if you end up with questions later, Cierra says you can contact her. Her email address is right there on the screen. Otherwise, this is the end of our presentation, and I'd like for you to have a great day for the rest of your day. Thanks. Bye-bye.
Thank you, guys.